CPR for newborns is different from adult CPR. This video will guide you through the correct steps to respond in an emergency for babies under 28 days old. Check responsiveness. Gently tap the baby's foot. Call their name. If there is no response, shout for help immediately. Call emergency services or ask someone to call. Look for chest movement. Listen for breath sounds. Feel for breath on your cheek for no more than 10 seconds. Place 2 fingers in the center of the chest, just below the nipple line. Push down about 1.5 inches or 4 centimeters at a rate of 100 to 120 compressions per minute. After 30 compressions, give 2 gentle breaths. Cover the baby's mouth and nose with your mouth and blow gently, just enough to make the chest rise. Continue 30 compressions and 2 breaths. Don't stop unless the baby starts breathing, help arrives, or you are too exhausted to continue. Do not use adult CPR techniques. Keep the baby's head in a neutral position. Start CPR immediately if the baby isn't breathing or has no pulse. Empowering future healthcare heroes with life-saving skills. Train smart, train with Nurexa.